Hi, I am Dr. Rashmi Ravindra, consultant dermatologist and cosmetologist at Fortis Hospital, Bannerghatta Road, as well as my clinic Meenakshi Cosmo Derma Care is at Arakere Micro Layout, Bannerghatta Road. So first and foremost thing in a scald, that is burning due to the splashing of hot water or oil from a pan, is to get away from the hot object. So get away from it, remove any cloth or the jewels which is coming in contact with that, and keep that particular part in running water, cold water, for 10 to 15 minutes at least. 15 to 20 minutes will also be okay. So depending on the area and the extent of the burn, the treatment varies. If it is of less than 3 inch or less than palm size, then you can be at home. Just keep that area under running water, and after that put a clean wet cloth on that. So if the pain and the swelling and the redness increase, that means if the depth of the involvement is more, better to meet a dermatologist or a plastic surgeon depending on the availability there. So there are mild, moderate and severe degree of burns. So if it is very small, you can take care at home, applying an antibiotic cream at a later date, and then meeting a doctor will be helpful. So doctor will decide depending on the depth and the size what treatment to be given next. So first and foremost thing is to get away from the hot source, then removing the cloth and the jewel which are coming in contact with that, keeping that particular area in running cold water for at least 10 to 15 minutes. Then putting a soft wet cloth, that is a gauze if it is available there, and then putting an antibiotic cream will be helpful. Then if you meet a doctor, then they will give the post-care treatment regimen if antibiotic oral is required, and the painkiller and the scar reduction creams at a later date.